This is Brian Eller with the Pima County Health Department COVID Education Liaison Team. We are now mobilizing to take on college universities as well as early childhood within this group as well, which will not affect the overall guidance that we're providing to you all. There's a lot to go through today, so we're going to try to go through this quickly. Obviously, there's going to be a lot of attention on the governor's executive order that came out yesterday, which was a bit of a surprise to us. But I think we are in a fairly good position to navigate that. So we'll talk about some of the details behind that executive order, what that means, and some of the content that you'll be seeing from us in the coming week or two. Just a reminder, any questions you have, please type them into the chat. Throughout the presentation, I will make sure to note those as we go through. If there's an area that needs to go back and be addressed further, we will do that at the conclusion of the wrap-up of the PowerPoint. We cannot answer individual medical questions concerns about the vaccine as it pertains to individuals. And we cannot answer questions about education funding or legal issues, though we are working to get some information regarding that for this presentation. Overall COVID data, you're going to see the visual here direct from the CDC website, the link down here at the bottom. Each one of these graphics is pulled from the website where that link is addressed, so you'll be able to pull that information on your own to keep up to date on it. In Arizona, some information here on cases by age group, deaths by age group, cases by race, ethnicity, and deaths by race and ethnicity as well. All of this is from the Pima County web page. For Pima County stats, so this is the new metric system that the Arizona Department of Health Services is using to decide school benchmarks. There's some differences and there's some similarities on this, and some things that we definitely want to address. So I'm going to do a quick share screen and jump over to the actual website to talk through some of the details around this. If you are just joining us, if you can just make sure to please mute your microphones to eliminate background noise, that's helpful. Thank you. So here's the ADHS schools dashboard. This is the new graphic. You can see here from the graphic that they are labeling Pima County as substantial in terms of the case rate, and our percent positivity as low, the transmission level overall being substantial. There's some information in here which we're still trying to work out from the health department side of things here locally as to how this substantial is calculated. We know that it's now a 7-day rolling average as opposed to the 2-week review and analysis of which was previously being used. Even with that 7-day rolling average, though, the data that we're having is showing that we are potentially still in the high case rate range, and that a percent positivity would actually be in the moderate range. So some of those details, again, we're still working out. We will make sure to get that information out to all of you as partners, either via email or on calls on this session or in other areas as well. So just a little bit of discrepancy there. One of the important things that you're going to start hearing from us as we shift our guidance is in reference to these indicators. So previously we were using red, yellow, green, right? Low, moderate, and substantial. You can see that what we were previously referring to as moderate has been broken into 2 areas. Moderate is now 10 to 49 cases per 100,000. And substantial is now 50 to 99 cases per 100,000. Previously, both of these were lumped into one larger indicator or metric, and now this has been broken into 2. It does align with the CDC criteria as a whole, but again, the numbers are and how the CDC defines it are where we're seeing a little bit of discrepancy between the state indicator and where we're at as a county and what we're seeing internally. So again, we will make sure we have solid information for you on that as the day progresses and potentially tomorrow. Same thing here for percent positivity. Previously, this was 5 to 10%. That would have put us in moderate. Now this is broken out into moderate and substantial transmission to, again, align with the CDC criteria. Looking at the recommended implementation of mitigation strategies and K through 12 school learning modes by level of community transmission. From the health department, you have heard us step back, and we will continue to maintain this stance away from recommending any kind of methodology of instruction. Sherry, I'm sorry, I'm just seeing your comment now. Is anyone else experiencing difficulty seeing the shared screen on the ADHS site that I have, that I'm, oh, okay. So Sherry, I'm sorry, it looks like it's just, well, there's a few of you that may or may not be able to see it. You may have to log off and log back in. Sometimes Teams does funny things. I'm gonna drop the link for what I'm actually viewing in the chat, just so you don't have to log out and log back in. And then I'll give you just a couple of seconds to open that. I'm looking right now at the second page of this PDF online document. So Barbara and Miss Dahl and Miss Chandler, y'all can open that up and just kind of follow along. And I apologize for the Teams issues there for those of you who are unable to see this. So at the bottom half of the second page, there is in bold letters recommended implementation of mitigation strategies in K through 12 school learning modes by level of community transmission. The Pima County Health Department again has stepped away from recommending any type of school modality for instruction. What we will do is we will continue to reinforce the use of strong layered mitigation as an appropriate method for health-related instruction at your school sites. In other words, what that means is that as long as you are implementing strong layered mitigation as recommended by the health department and the CDC, we will support the methodology of instruction that you as a school site or as a district choose to pursue. According to this document from ADHS, though, as it pertains to the executive order, because we are considered substantial transmission, this means that elementary schools should be in hybrid learning mode or reduced attendance, that middle and high schools in hybrid learning mode or reduced attendance. So I do want to drop over to the executive order just for a moment, because there are some details in this that are important to look at related to what the governor is expecting for this open in-person learning. I should just be able to open this, but it's not. Okay, let's do it that way. Apologies. There we go. All right, so I will drop the, I can't drop the link for the executive order in here, but what I will do is I'll drop the link for the page on where you can access it. You'll have to download it and then pull it up as a PDF. So if we zoom in here, you can see where the governor says that ADHS must immediately transfer to low, moderate, substantial, and high. For counties with substantial, all schools shall be open with in-person instruction and virtual instruction options. Physical distancing should be maximized to the greatest extent possible. And then under subpoint 2, under section B, section bullet point 2, middle and high schools may reduce attendance to reduce transmission and increase physical distancing. So there is some open to interpretation here in how the governor is declaring this. What the health department's stance is currently going to be on that is based on the CDC recommendation, which we can pull up here in a minute. If we're in substantial transmission, you should be physical distancing. 6-foot physical distancing is mandated. So this is that's the CDC guidance, and we will align with that until we get into moderate transmission. Okay. The ADHS bar graph question from Superintendent Yeager. I will show you where to find that in a minute. However, because of this executive order, what the governor has stated is that the dashboard metrics must now be reflected by this new graphic. So this is the new graphic that the governor is mandating that Arizona Department of Health Services uses in order to convey this information over to schools. You may see this change potentially in the next week or so. This was a very rapid change switchover in communication strategies from the state. So that's where that information has gone from. However, you can, if you go back to COVID-19 and the data dashboard, you will see graphically displayed in the summary by county the information that was previously reflected in the school's dashboard. Just know that these numbers are reflected in aggregate all the way back to March of last year. So it doesn't do it on the 2-week rolling average like the school's dashboard did previously. Okay, so there are differences between this specific graphic and the one that the state was using for schools previously. Okay, I am going to pull up the CDC return to schools guidance. And I'm going to try to spell it correctly here. I hope this is not reflective of my my education. Please forgive that. So if we scroll down on these CDC return to school recommendations, there is right here in the phase mitigation, you can see under substantial transmission, it states very clearly physical distancing of 6 feet or more is required. That's direct from the CDC. Okay, physical distancing of 6 feet or more is required. So please note that that is one thing that our local health department is going to continue to support until we get into the moderate transmission yellow graphic. We will stand with the CDC guidance, and we do believe that that we are in the space to do that. Okay. A question from Ms. Ryan. AZDHS did replace the older 3 metrics in the bar graph. That is correct. So that old bar graph that you saw previously, I will post the CDC link here as well, so you have that. The older bar graph that you saw is no longer available. It is now just this document. This is what you will see. So if you go to schools data from the AZDHS Health Department page, so you scroll down here, you go to schools dashboard. Previously, there was that whole data set that you saw that is now all replaced with this new PDF document, okay? All right, so that was a lot to get through. Please allow us a little bit more time to process this in more detail. It is going to take us some time to get into all of the details behind this. And I'm really referencing the metrics themselves and the numbers that we see reported directly and how the state is considering those metrics. So give us just another week to make sure we've got all that down. And then we will continue to advise you in the best capacity. So the best thing I can tell you for now is that according to this, we're in substantial. We will follow the CDC operational strategies as it pertains to substantial transmission in the orange. It does not change our guidance in what we are doing in terms of how we guide schools. That's all going to remain the same. We're not going to see many changes there. So there you go. There it is. Now I've got to go jump back over and find my PowerPoint here. It disappeared there for a second. Yikes. While I'm doing that, are there any other questions related to these new updated changes that we can potentially answer for you? Okay, cool. We thank you for your patience as we digest this. Again, this was a bit of a surprise to us yesterday. So we will have better interpretation for you in relation to all of this. The big bullet points over here on the left of the PowerPoint, which we'll make sure we get out to all of you. Cases in Pima County, again, we continue to see a downhill decline. However, it is worth noting that we are still in a high rate of transmission. We were at 107 according to what we saw yesterday, which is why that's where some of that confusion that I was referring to earlier on the previous slide. It's like, well, that doesn't really put us at substantial. That should still put us at high according to what the metrics of the state are. But we'll have more details for you on that. Pima County deaths total reported in Arizona is 15,650 as updated by the 1st of March earlier this week. We've got about a fairly even split, a little bit more reflected in male population than female. The positive admissions per MMWR week, that's mortality and morbidity weekly report, continue to decline throughout the weeks here. Reflective graphs of ICU bed usage versus usage by COVID-19 patients in Pima County in this graph. ICU beds and vents used by COVID patients in Pima County are reflected in these graphs. This is more just informational for our hospital metrics, which we still are using, though you may see some changes in that in the next week because of this new guidance by the state. Reporting from long-term care and assisted living facilities is included in this graph from up to 215. We'll get an updated graphic on this, as well as the long-term care versus non-long-term care COVID-19 deaths by mortality and morbidity weekly report. Pima County testing data. I'm going to jump over to Kristen. She'll give you some overviews on these next slides.
Hey everybody. So as you can see here, the total number of tests being collected is going down, but we still have a significant positivity rate. And we are seeing that lots of our tests are being collected in the 20 to 44 age group. So that is important to note. Again, through tomorrow, you can still contact Casey and myself to gain access to a survey which will allow you to express interest in doing on-site antigen COVID testing at your school sites. We have lots of folks that are working on our onboarding process for that. So feel free to reach out to either of us. I will put my email in the chat if that's something that you and your school community may be interested in.
I did get a quick question from Ms. Shaw there. Information regarding the future free COVID-19 testing in Pima County. Yeah, there is some new information on that. There was a Board of Supervisors meeting on Tuesday where it looks like that's moving in some defined direction. I am going to get a full analysis and understanding of that. I have been unable to do that this week, but we will make sure we have the conclusive information regarding that. Kristen, I don't know if you can speak to what that decision was on the Board of Supervisors meeting, but what I can say is that utilizing Binax for your point of contact testing on site for symptomatic students and staff is going to be a helpful thing for that.
Yes, and to respond to Yvonne's question in the chat, we do have a specific reporting system by which those Binax results will need to be reported, in addition to the reporting that you all have been doing throughout regarding positive cases, whether it's through a Binax test or anything else within your community.
Yeah, so I know that there's going to be some dual reporting there. The simple report is really quick and easy to access and fill out. The Qualtrics, which you all have been using to fill out close contacts and positive cases, I know is a bit of a burden. In order for us to continue to contact, trace, and case investigate in a timely manner, we do need that information. But we are looking at ways to align that. We don't have the system in place as of yet, but we are looking at getting a system that will allow individuals completing the simple report to have that point of entry into the case reporting, so you won't have to dual report. The piece that we're really hinging on right now is the close contacts, but we're looking at different ways around that. In regards to the reliability of the Binax test, If it designates you as a positive, you are definitely a positive. If you're symptomatic and the Binax test labels you as negative, it does need to be validated with a PCR test. So there are some false negative results with that test. Important information to know. COVID variants. This is slightly outdated, this slide. I don't know the current numbers for Arizona, but what's reflected here are the UK variant, the South Africa variant, and the Brazil variant. What we know about those, hold on, let's get there we go, is that the B117, which is the UK variant, has currently 6 cases. There's potentially more than that identified in Arizona. It's been detected in 44 states. There's been no evidence to support increased illness or increased risk of death with that variant. We do know that it spreads more effectively and quickly than other variants. The South Africa variant, as of the 27th of February, had been detected in 10 states with 22 separate cases, as shares some mutations with the B117. And then the Brazilian version, which is P1, has been detected in 4 states who have been reported in 5 separate cases. That one of the things about the mutation with the Brazil is that it has some mutations which affect its ability to be recognized by antibodies. We do know the level of genomic testing in Arizona, though I would need my testing group to jump on the line to answer the specifics of that question. And we know that that level is also being increased. So Kathy, if you can send me a separate email on that, I will make sure that we have that information. What we don't know about these variants, though, is how widely they have spread. We don't know if everyone's who's getting it is actually getting tested. We don't know how the disease caused by these new variants differs, and we don't know how that's going to be affected by existing therapies, vaccines, and tests. And if we know anything about COVID, it's going to take us a little bit to learn all the details about it. But we are moving in a positive direction with that. Okay, so jumping back a couple of slides. Tiffany, if you want to go through these slides.
Sure. Why are contact tracers important? So contact tracers are really important at making sure that they help eliminate the spread of COVID. They can notify you before you actually are notified by who you were a close contact of, and that will help us to limit the exposures. If you are contacted by a contact tracer, we ask that you please speak with them, give them the information that they are asking. This helps us to continue to keep the spread down. And case investigators can also be great at referring individuals to needed COVID-related resources. Next slide, please. And once again, please answer if they do call. They will not ask you for any personal information other than the information according to your close contact. They do not ask for information for your insurance or social security numbers. And these conversations are all private and confidential and protected by law.
Cool, thanks, Tiffany. Masks.
So some things to remember, you might have seen or heard about people double masking. And so if you are going to double mask, it's important that you put a surgical mask under your other mask that you're wearing. But what's most important is the fit of the mask, because obviously you don't want particles coming in or out. So it as long as your mask is fitting you appropriately and obviously covering your nose and your mouth and everything like that, that is more important than double masking at this time. People are still on the fence about whether or not if that's actually more effective. So that's the latest mask update.
Cool, mitigation. And there's a few of you, I don't know why the slides are not coming up here. I'm gonna try a different method really quick to see if we can get this remediated. Let me go this route. Okay. Leslie and Rachel, are you able to see this now?
Yes, thank you.
Okay. We'll share out this way instead from here on out. Okay. So what we did right now is we just went through this graphic right here around the masking. We went through some of the variants, the contact tracing, and now we're on the slide with mitigation. Everyone here is familiar with the reduced quarantine and the close contact slide. Again, please remember, report those close contacts. It's really important for us to know about those. Our universal guidance in terms of mitigation is the universal and correct use of masking, physical distancing, which is the 6 foot that we just outlined with the CDC strategy, which they are citing as a substantial transmission, important point of mitigation, cohorting or potting within your classrooms, practicing hand washing and respiratory etiquette, cleaning and maintaining healthy facilities, contact tracing with quarantine and isolation, and testing for indication and monitoring those testing so that we can follow up with contact tracing, quarantine, and isolation appropriately. You're going to see the order of some of these slides kind of change. We've been putting this together and working on it on almost a daily basis. The Swiss cheese model of layered mitigation works. You've heard me use the metaphor of pastel azteca. Right, so this is the idea that any one of these single layers of mitigation has holes in it, and you can get mice every now and then that sometimes eat away at that cheese, which reduces that barrier even more so. One of the examples that would be easy to point out would be masking. Maybe you have folks in the community that are opposed to masking for various reasons, or vaccine. There's folks that are experiencing vaccine hesitancy, or who for religious reasons decline to receive the vaccine as well. So the most important approach, and this is the thing that you'll hear us say over and over again, is this layered mitigation. All of these layers superimposed together is what will keep you safe. So if there is, for some reason, the inability, let's say you've got 1 or 2 students which are masking incorrectly, because you have good physical distancing, hand hygiene, ventilation, contact tracing, and support for vaccines, quarantine, and isolation, you therefore will have enough layered mitigation to prevent serious outbreaks from happening at your site. Okay. Went over the contact tracing, case investigation, physical distancing. Kristen King, that's you. Sorry.
Sorry, folks, I was muted. Just wanted to reiterate exactly how important it is that we do physically distance. We can see here in this picture how there is a clear distinction between these larger droplets on the left and the more aerosolized, smaller droplets, and how masks can prevent and limit a lot of these droplets, but they can travel up to 2 meters, which is why we have this 6 foot physical distance in place. And it can occur both indoors and outdoors, which is why masking and physical distancing go hand in hand and are so crucial in preventing spread. Next slide, please. So we have seen in various research studies that as distance increases up to almost 7 feet, that exposure risk and risk of transmission decreases. And there are lots of ways to go about physical distancing beyond just seating people 6 feet apart. You can move your classes outside, take advantage of that greater space, use the playgrounds, use the field, stuff like that. Stagger class change times and try to limit movement of students by moving only teachers and staff. Using tape on the floor to show students exactly how to maintain 6 foot distancing and model that with your teachers and staff so that people are cognizant of what is going on around them. Utilizing large hallway spaces with windows and doors, as well as gyms, laboratories, auditoriums, etc., and removing furniture in order to maximize that space. And then as we've seen in some of this new guidance and CDC guidance, the alternating morning and afternoon shifts or alternating day shifts to reduce total attendance. Those are all ways to encourage and have effective physical distancing among many, many other methods.
So I am gonna shortcut us through the rest of this because we are right at our time, and I do not want to hold you past what we have promised. So we're just gonna cut through these really quick. What I want to offer to anyone on this call is if you have questions related to any of these specific mitigation strategies, there will be subject matter experts on our team internally that will be able to guide you through these various mitigations. So same thing with proper hand washing, respiratory etiquette, cleaning, maintaining healthy facilities, which you can find Stuart's contact information right here on the slide. Improving ventilation, Dixie Siegel is our internal subject matter expert on that. The vaccination K through 12 overview, we're at 75 to 80% of K through 12 receiving their first dose. There are 3 ways to register if you have not already. If you have staff that have not been able to register for their first vaccine, please get that information to us as soon as possible today, because we are looking at a potential opportunity to get those staff. If they have appointments and it's later in the month, then have them keep those appointments. But if they've just been unable, and please remember to focus on custodial staff, transportation staff, food services, those supplementary support staff that are really critical to maintain person-to-person and on-site instruction. Slides here on vaccine safety. Our overview of case count, we're at 3616 as of today, 60 total outbreaks. Basketball continues to be an issue, folks. We had another situation this weekend that, there's only so much we can say on that. Testing is available, running to questions and answers. So I know that was a really fast fly through. Let's cover the ones in the chat here. When using the Binax test cards, is there any risk of air particles dispersing when throwing away when the card is dry? What are the risks when using these cards? I will get answers to you on that. That is part of the training that you'll go through if you do choose to utilize the Binax system for testing of symptomatic screening staff and students at your site. The risk is fairly minimal because you should be using PPE when administering those tests. Will you address PCHD guidelines, quarantine guidelines, post-COVID vaccinations? Yeah, so right now the guidelines around quarantine post-vaccine is once you receive your second dose, you have a 14-day window where you are not exempt from quarantine. You must still follow the quarantine guidelines if you're in close contact with a positive case. Once those 14 days elapse, you have 90 days where you have immunity and you are exempt from quarantine and isolation. We are still studying that. We're going to learn more about vaccines and what they mean in terms of the quarantine and isolation. But for now, it's, and we have a graphic actually, Sherry, I'm glad you put that up. I meant to put that in the presentation. We have a graphic that specifically talks about this guidance that was just developed by one of our partners at the university. We'll make sure to have that up and out to everyone on this call today. If someone on my team can just help me make a note of that, that'd be helpful. Specific PCHD contact for those needing first dose registration. Sylvia, if you can drop your email address into the chat there to respond to that. And open question from Miss Greenbaum here. Can anyone suggest a source for child-sized surgical masks in bulk? So if anyone has a link to that connection, if you could drop it in the chat there. We do know that surgical masks, depending on the type, have an efficacy rate sometimes of 32.7% filtration. It really is, as Christina mentioned earlier, more about fit than it is about the fabric itself. So making sure that there is a tight fit that covers the entirety of the face is a really critical piece of mask efficacy. Sylvia dropped her email address there into the chat for you, Daniela. Please reach out to her ASAP. We do need to get those names in as soon as possible. I've gone 3 minutes over. I know we had to cover that executive order. That was a really critical part of what we needed to communicate to you all. So I am okay with us skipping over parts of the PowerPoint today. Just know that we'll be adjusting our guidance as necessary for that, though that adjustment is going to be very minimal from our part. The Pima County Health Department will continue to reiterate that strong layered mitigation is the critical centerpiece for return to schools. All right, we're going to wrap it up at this point. So I'm going to stop recording. We will take any other further questions